So, Idan, very good to meet you.
And you too, John, and thank you so much for willing to come on Feel Good with ME, my podcast about ME, fibromyalgia, brain fog, long COVID. I'll quickly tell you about me a little bit and remind the
Very
audience as
good.
well how I struggle, and then you will tell us a little bit about you and what you do because it sounds very fascinating. I know you deal with pain specifically, so that's something that a lot of us suffer with.
So,
So basically, in 2007. I guess I had like a flu, maybe the kissing disease, or a mono. I'm not exactly sure what happened. There was quite a few things going on. And from a very active, strong, about 23-year-old man at university with a girlfriend, with a job, mountain bicycle professional competitor, I became this, it's so like I had a flu that everything was hurting and I could barely get out of bed by myself. My brain was foggy. I was always very good with my speech. I'm dyslexic, so I think my gift is my talking and my memory. And suddenly I was stuttering and stammering and struggling to remember names, places, everything. And it started with shooting pains mostly with my feet going up my legs to my back to my neck, and then everything I touched just seemed to be hurting me. So that's more or less what happened. Over the years, it became worse and worse. I've learned to change my diet. I tried many different diets and supplements, and I tried hyperbaric oxygen therapy, which really helped me. I did something that is really crazy, but really helped me as well, was a 28 days water only fast. So I had Dr. Alan Goldhammer from California. He has a clinic there that is super, and he just helped me over the phone. And another guy from South Africa, there's also a doctor that also supervised me kind of over the phone because I couldn't get there. I didn't have the money also. Being a fruitarian really helps my digestion, my IBS as well. Gluten-free, sugar-free, salt-free, all of these things help a little bit as well. But I'm still not cured. I'm still struggling. I'm a lot better. I'm functioning. I kind of work. And so I'm very grateful for the progress I've made. Also, another thing was very difficult to explain to people, especially my family and friends, from this being this fit guy, super friendly, super social, to this guy that's always under the duvet, like constantly. No one could get me out of the house. I would, and I would struggle with pain and just want to isolate. So that's a little bit about me, John. Please tell us who you are, what did you study, how did you get into this field that you are in, and I'm sure I'll have questions coming up as we go along.
so first of all, Idan, I don't quite know how you came about my name. I was away, I was teaching, and I received your email, which came through a National Training Centre, NTC, and then they sent it on to me. So I'm not quite sure what kind of, investigations or what kind of surveying you did or how you managed to trip over my name, but I a number of different hats. I was just actually speaking yesterday with a group of structural integrators. I don't know if your audience will know what a structural integrator is. This is a form of manual therapy that was set up by a woman called Ida Rolf. Some people call it Rolfing. And they've invited me next year to come to, there's a European guild, and they've invited me next year to come and present over a 6-day period with other individuals. Now, I don't have qualifications in structural integration, so it's a real compliment when they invite somebody from outside of their discipline. But it was just funny when I was talking to them, they were saying things like, John, you wouldn't be aware of, and John, you wouldn't know. And I was thinking, my goodness, they just don't know my background, really. They don't know. And I suppose that's a life lived. So my background is that I'm a clinical anatomist. So again, maybe the people in your audience may not know what a clinical anatomist is. So a clinical anatomist is an individual who is charged with the responsibility of delivering the anatomy module of medical degrees. So we have to understand the anatomy of the human body, and we're expected to know absolutely everything, everything about the human body. I'm also a physiologist, an exercise physiologist, and I'm also a manual therapist. They're the different hats. The odd thing is that people often say to me, well, what brought you into the area of anatomy? Well, what actually brought me into the area of anatomy wasn't so much anatomy in itself. It was the topic of consciousness that was my real interest as a child, which I suppose makes me a little bit geeky. I'm not too sure if it does actually. I think there were lots of kids who were my age growing up in the 50s and 60s who were influenced by people like Carl Sagan. If people don't know who Carl Sagan was, he was famous for a TV series he had called Cosmos, and other individuals who would have influenced the way we thought. Even the likes of Star Trek, the original series, really encouraged kids of my age to look out and to think big. And I'm not too sure that kids nowadays are encouraged to think that way. And in fact, it's almost sad. Everywhere I go, I just constantly see people on their phone, not communicating with each other. We'll see. We'll see. Every generation seems to sort themselves out. And I hope that these generations will do so. So, over the years, and I've really been very lucky. I consider myself to be very lucky, even in that I met what people would call some of the pioneers in the field of pain management, etc. One of my mentors was Dr. David Simons. If people don't know who Dr. David Simons is, and I'll tell you a few little things about David, because I often say to people, David Simons was the first human being to go into space. And they say, oh, that can't be true. That was a Russian cosmonaut. No, it was actually Dr. Simons who was the first human being to go into space. Yuri Gagarin was the first human being to orbit the Earth twice. But David was really involved in the very early genesis of what has become NASA. And he met a woman by the name of Dr. Janet Travell. And Dr. Travell became the first female doctor to go into the White House. She was the doctor to President John F. Kennedy, who suffered with low back pain. And she was brilliant at coming up with, making ergonomic aids like a rocking chair she made for him, etc., which was, specific to his somatotype. And of course, they're famous for something called the Big Red Books. I'm not sure if you're familiar, Eden, with the Big Red Books. So the Big Red Books are basically the myofascial pain and dysfunction manuals, where they were really seen as the kind of the mother and father of something called myofascial trigger points. Now, I just took one or two notes. I don't generally use scripts, right? I'd scribble down a few little notes, just a few little key points or whatever, as we're talking. And I noticed, for instance, you were saying, that everything was particularly good in your life. Normal, I think, is one of the words you used. But you were talking about, in your case, the pain or the sensations that you felt. Now, by the way, I specialize not just in pain, I specialize in changes in sensations. So that's a really important point for me to make, because not everybody has pain. There are some people, for instance, who would have an itch. It could be on their abdomen, and it's there 24 hours a day, 7 days a week. Think about how that must make a person feel. And there's nothing they can do. They cannot scratch it and get relief, even temporarily. There's nothing they can do about the itch. Or they could feel that there's water, running down the body. In your case, and I don't want to put words in your mouth, so I want to make sure that I'm accurate. And this is so key to everything that I do. You have to listen to a person's story. Every single person is individualistic and different. And that sometimes might scare people, but believe me, it's not anything to be scared about. Once you have the skills and knowledge to be able to deal with an individual, you'll be absolutely fine. The problem, I think, is that we have this mechanistic approach to humans, and there's a kind of a one fits all, particularly when it comes to drugs. And I'm not saying, by the way, the drugs are bad. There are some people say, "Oh, John, I would never put a drug in my body." Well, good luck to you. Good luck to you. I happen to think that if you're in pain and you can take some type of medication to either eradicate the pain, and that's good. It's not good to be on drugs long term. And of course, we have an opiate addiction problem here in Europe and also in America and Australia and in other countries. So there is an issue to be dealt with. But my goodness, if somebody is in constant pain, of course you'd want to take some type of medication to try to alleviate or eradicate that. But you mentioned that you had pain going up the body. Is that right, Eden? Did you say that to me?
I think that's how it felt at the time. It was quite a few years ago, but it's definitely started with my legs. I just couldn't step on them, and I think, yes, it was coming maybe just because I was standing, so the pain would be shooting up. That kind of
Shoot up. Okay, so just to put that into context for you, as a clinical anatomist, let me explain to you that pain cannot shoot up. And so now when I say cannot shoot up, remember, we have to finish the sentence, okay? So in case anybody starts to go, hang on, he's contradicting him. No, no. If we look at the nervous system and if we look at all of the science and research related to the nervous system, you will find that at the top of your, what's called your vertebral column or your spine, this is where the spinal cord begins. So inside your head, your cranium, is your brain. And then we have other structures just inferior or just below the brain that we call the pons. And then the medulla, the medulla oblongata. And then your spinal cord begins. So we call that the spinal cord proper. So your head, this big bone here, has an opening right deep in here. And through that opening is where the spinal cord comes out, okay? So this is called the foramen magnum. A foramen is an opening or a hole through which things can pass in the human body. So this is the really big one, the foramen magnum. And so the spinal cord comes out. And when the spinal cord comes out here, then nerves will come out from both sides. So right and left will go out, and off they go, the nerves, and they'll go to a muscle, they'll go to an internal organ. So for instance, your esophagus is an organ, the trachea is an organ. And so they'll go to various different parts of the body, like the tongue, or it could be a joint, or they'll go to a patch of skin. We call that a dermatome. So remember now, there's right and left. Yes. So once they come out of the spinal cord, so just beneath the skull, we call these spinal nerves. Now, above them, you have nerves that are inside your head, and we call them cranial nerves. So they're a very, very different thing to the spinal nerves. And the spinal nerves in the upper part of the body are a little bit complicated, and they're a little bit complicated in the lower part of the body, but they're not really complicated in between, in what you might call your thorax or your abdomen. But the ones that go into this fella here, which is called your upper limb, that they scare the hell out of medical students because they have to learn them. So these nerves, if they're irritated, if they're damaged, if they're somehow tethered, in other words, they should glide relative to tissues that are, surrounding them or that they're traversing through. But sometimes instead of gliding, and this is a huge issue, they can become adhered. So now instead of gliding, they're pulling or being pulled. So you're not getting that nice gliding. There should never be sliding, by the way. People say sliding all the time. If you get your hands and push them together and then do this, you'll immediately feel heat. So Mother Nature, in my estimation, this is my opinion, Mother Nature would never put such a foundational principle into the construction of a living construct. Because if I kept doing that, my hands would just be red raw, the skin would begin to break, and it would be horrible. So in fact, the human body resists sliding, which is a form of friction, two things touching. And we have something called hyaluron. A lot of people know about hyaluronic acid because the advert on TV now, hyaluronic acid because you're worth it. And hyaluron is a non-compressible fluid which allows for sliding, or beg pardon, gliding to take place without friction. But of course, that system can go wrong, and therefore things can become sticky and mucousy and thickened, and that can lead to adhesions, and that can then lead to tethering of nerves. So the main point I want to make is that if there is a tethering or an insult, not just an injury, an insult to the nervous system, then a patient will feel pain traveling down. So you won't hear somebody saying the pain is coming from my wrist up to my shoulder. There is no research paper in the world that would support that. But yet the patient says to you, John, I feel pain from my elbow to my shoulder. So then you say, well, what is that then? Is that psychosomatic? Is it in your head? Are you making it up? Because the science tells me that pain doesn't travel up the body, it only travels. So if somebody has sciatic pain, it runs down the leg. So it's a little bit like if you look at the construct of a bumblebee, and NASA, by the way, NASA are famous for having a plaque on the wall of the entrance to NASA where it says, a bumblebee should not be able to fly. And then underneath it, it says, tell that to the bumblebee. So the reality is, if somebody's coming in and they've got pain shooting from their foot up to their back, well, tell that to the person who has the pain. Because you telling them that the science tells you that you can't have pain traveling upwards, means nothing to them. So, and that is where myofascial trigger points come in, because I don't know of anything else other than myofascial trigger points that can explain pain traveling upwards. So, for example, if you have myofascial trigger points in a little muscle, it's a large muscle actually, but it's a smaller muscle in the context of where it is. It's in your gluteal area. I think everybody knows their glutes. It's a famous muscle that people like to work on now. In the 2025, we have booty builders in the gyms and so on. My goodness, people are very interested in their glutes. But deep to your gluteus maximus, we have a muscle called gluteus medius. Now, if you have myofascial trigger points in gluteus medius, then you will have pain referred up over the belt line into your lower back. So remember, as I say, the gluteals are innervated by a nerve called superior and inferior gluteal nerve, and those nerves would actually fire pain downwards. So therefore, if a person is complaining of pain described as shooting up, we know it can't be nerves. So I don't know if you know of anything else that can refer pain upwards, but myofascial trigger points would be the only thing that I can think of. Now, there are people who have fibromyalgia, chronic fatigue syndrome, or some type of autoimmune problem, and they often suffer with myofascial trigger points. And treating myofascial trigger points is useful. The problem is if you don't understand why the myofascial trigger points are there in the first place, they'll simply keep coming back. But having said that, it's probably useful, at least if somebody knows how to treat them. It's probably not a bad thing.
Amazing.
I
Thank you
hope
so
never. I spoke too long, maybe, so I'll try to, if I can, I'll try to keep but I'm Irish. My answers are always long.
That's good. For me personally, I really like analogies and understanding things in depth. So that's really helpful. I'll just also add that at the beginning, well, it lasts maybe 10 or 12 years. Also, my nodules everywhere were really hurting. And
What do you mean by
bro,
nodules, Eden? What do you mean by nodules?
I don't know if it's a lymphatic system thing, but from what I was reading, like everything here on the sides and underneath my armpits
Okay.
were
You
really
could feel,
hurting.
you could feel some little, you could feel something like that felt like a pea, like a pea.
I think so,
Could you?
yeah.
Yeah. Okay. So these are submandibular lymph nodes. And then, of course, this is the armpit but these are auxiliary. So yes, I mean, it's possible. So therefore, that happens particularly when somebody is fighting infections. You'll find that, for instance, at the back of the knee or in the groin, we have lymphatic vessels, which are just deep to the skin. The lymphatic system is deep to the skin. The lymphatic vessels can be a little bit deeper, but here they're quite accessible. You can feel them with the spatula, the flat part of your thumbs or fingers. So on you, they were felt enlarged, they and painful.
That was so painful for at least 10 or 12 years. It was one of these things that until a few years ago it was very difficult to shake, the constant pain. And also a pain in my throat and swallowing. It's only really in maybe 5, 6 years that I've managed to say that I barely feel it now. I barely feel it. But since 2007 to 2019, that was a constant struggle. With the feet, what I've managed that worked for me is going barefoot shoes. I tried all kind of orthopedic shoes, but then I discovered barefoot shoes, and I realized that my arch totally collapsed. The muscle in the foot here was totally collapsed, and now if I stretch my feet, you can really feel there's like a muscle there, and my arch is not so collapsed. And again, I never had any of these things before the condition. What would be interesting is then for people who have similar symptoms, and when I speak to people with fibromyalgia, ME, CFS, we all share such similar symptoms. What kind of things
I just
you
say to
think?
you, CFS, so chronic fatigue syndrome. So I'm dyspraxic, okay? I only learned this in more recent years when my youngest daughter was being assessed in school and she was assessed as also being dyspraxic. So when I did my original degrees, and even now I'm working with surgeons, I'm working with, medically qualified individuals, and they use abbreviations all the time. And I have to stop them and say, please don't use the abbreviation. Please use the full description, because otherwise my brain cannot cope with it. So for listeners who are listening to us and then they hear, IBS, CFS, it's like it just becomes overwhelming for them. So I think what we try to do is, if we can, I'd rather use the full term rather than the abbreviation. Otherwise, what will happen is they'll be trying to work out what it is, and they won't hear the next few words. And then by the time they've caught up, they're confused as to what we're talking about. So we're talking about a range of autoimmune problems, which have been given names such as chronic fatigue syndrome. Remember, the word syndrome means we don't know what it is or how it's come about. That's ultimately what syndrome means. And it's usually multifactorial. There's not just one aspect to it, but lots of aspects to it. So therefore, if you knew what the target was, you'd shoot and aim at the target. But the problem is, it seems to be multiple targets. And so people don't quite know what to do. Okay, so back to you, Ethan. Sorry, think that's helpful, I think.
That's a very good point, absolutely. So basically, I think what would be very interesting for us to know is what kind of things you've seen that help people with pain, with long-term pain, because it's something that as I'm sure you know, it's so debilitating. Yeah, it stops us from working, for socializing. I know people with fibromyalgia and chronic fatigue syndrome that they have children and they're struggling to fulfill their home duties. And it's so difficult and sad. And often the people try that. Even my doctor, I was very lucky. He wanted to give me anything I wanted, any exam, any medication. He was really, really kind. And he was not the only one. I had another doctor, but we didn't know where to go with me. And whenever I went to do blood test or something, it felt really good, especially I'm vegan, my cholesterol was low, my blood pressure was good. So they would be so baffled. I always take vitamin D3 and B12, so those parameters looked really great. I never smoked, I don't really drink. So they really struggle with that. Is there something you know, or how you do, or you recommend, or you've been seeing things that can help?
It's a little bit difficult on a podcast because I've taken a particular journey in my life, and I've ended up. Oh, I think I have these in the wrong way around. Hang on one second there. I have indeed. I've ended up where I am by chance, because I happened to turn right instead of left, and I met this particular individual. And therefore, it's very, very hard to be able to make a particular statement to you and then for that statement to make sense to the listener. Imagine life is about being on a train and you have to go through, 260 stations or thereabouts. Some people get to 300, but somewhere between 240 and 300 is the typical average number of stations that a person goes through. And I'm at station 225. And I'm talking to people who have maybe gone through the first, 16, 18 stations, but I'm trying to describe to them a landscape that I can see that makes absolutely no sense. I've never seen a landscape like it. And so therefore, if I make a particular statement, people will immediately say that's ridiculous, because you have to have time to be able to put it into context and explain how you've come to that, how you've come. So first of all, consciousness is a hugely important topic for me. And many of the things that are happening internally in your body are happening in a subconscious realm. In other words, you haven't, thought about taking a breath. You don't have to think about a heartbeat. You don't have to think about digesting your food. These are autonomic. These are happening automatically in your body. And unfortunately, the brain, or what we call the brain or the mind, also has a role to play, because there is a continuity in that regard. So at the end of the day, what I would say is that in many of these cases, there is a dysregulation. There is a disconnect between one reality and another reality. Now, when people say to me, what do you mean by realities, John? Well, for instance, you're standing on a planet that is moving through the cosmos. Now, there are some people who have religious beliefs and they won't believe this. But this is my stance. You're standing on a planet and the planet is rotating at roughly 74,000 kilometers per hour. I had somebody, by the way, who was the head of neurosurgery, and he heard me giving a little presentation, and afterwards came up to me and said to me, said some nice things. Well done, John. Nice presentation. And I happened to say, this is going back now, maybe 15 years ago. He said to me, "Yeah, I hear you saying you're going to the United States in the next week or so." I said, "That's correct. Yeah, I'm flying over to the States." He said, "And how is your airplane going to land?" I said, "Sorry, Prof, I don't quite get what you mean." And he said, "Well, I heard you," he said, "in your class saying that the Earth is rotating at a ferocious speed. So how is the airplane going to land if the Earth is rotating?" And I was just blown away by this, that this is the head of neuroscience that was saying this to me. So obviously people find it difficult, either one, because of dogma in religious belief there that they're not going to accept it, even if it makes sense, or they truly don't accept it. So the reality is the earth is spinning, but you don't feel that. In other words, it isn't until the more modern man, that maybe the 1500s, Galileo and others, and they were ostracized by the church for their thinkings and their teachings. But let's just say anyway, it was around this time where they were using mathematics and they were using study of the cosmos to figure out the fact that the Earth was in fact rotating, but you'd never feel it. Could you imagine if your consciousness allowed you to feel the Earth rotating? It would drive you demented. So your reality is tainted, by other influences. And, people's reality can change. So internally, if the brain, let's call it the brain, if the brain perceives a threat of some kind, then there is going to be a fight and flight response. Now, what's frustrating is that you're thinking to yourself, but there is no threat. I feel normal. But you see, that's the kind of the strange thing about it. It's the fact that the brain perceives there being a threat. And unfortunately, the longer this goes on, the greater the effect that it can actually have. It can actually become progressively worse. So we have specialized cells which are very misunderstood in the human body called glial cells. People think that glial cells are responsible for increasing the sensation of pain. Well, that is true in one aspect, but glial cells have a number of characteristics. Glial cells are also responsible for down-regulating pain. So they are inhibitors. Now, the longer you have a condition in the human body, such as fibromyalgia, there seems to be a relationship with the death of these specialized glial cells, which means then that your facility or this faculty that you have, this facility of inhibiting, of turning down pain modulation, suddenly you lose that. And then if somebody just touches your skin gently, you go, "Oh, that's horrible." You go, what do you mean? That feels like I'm burning. And this is called allodynia. So one needs to try to have some type of intervention as early as possible. And you've used several. What did you say you did? You did hyperbaric chamber. You've done water-only diet. I mean, I've also got a master's degree in nutrition, by the way, but it's something I very seldom ever talk about because now, because of the internet in particular, I mean, there are so many people claiming so many things on the internet. It's just very, very hard to get your head around nutrition. How long was your water-only diet, by the way?
I only drank spring water from a glass bottle. I chose a particular brand from Scotland. It was very low TDS, typically dissolved solids kind of water, so very little mineral in them.
Was it sparkling?
No, it was not sparkling.
No, still.
It was still. And it was for 28 days. 28 days, only water. And I started at about 72 kilograms. And after 28 days, I've ended at 49 kilograms. And it's one of
So
the...
from your perspective, though, what were you thinking? Like, why did you think that only drinking water for 28 days would somehow have an impact on, your pain scenario or your fatigue, or what was it you thought that would happen if you only drank water and not solids?
Because I truly believe that I'm affected by kind of something of a virus, so my immune system is attacking me. And from my research, and I'm not going to claim it's a medical level of research, it's just my research. I have a degree in
Sure.
psychology. I'm an atheist. So I just tried out of desperation as well. And I read about
Yeah, and I
another
understand that
guy.
as well, by the
Thank you. And there was another guy that I heard. His name is Herbert Shelton. He was a physician. I think he died in the 40s already. He wrote some books about how water fasting is a religious, spiritual thing. Even Pythagoras asked his student to water fast, and all kind Greek gods used to ask this to people. And I think Jesus fasted for 30 or 40 days, and all kind of things like that. And
it's part of Ramadan, and it's part of other religious beliefs that where they would do this type of thing. Absolutely, yeah.
exactly. And also in Judaism, my background is Jewish, and the Yom Kippur is when Day of Atonement, 25 hours of no eating, no drinking, so dry fasting, which I've also done dry fasting, which I can tell you a little bit afterwards, which is a more harsh form. And I saw a video of a guy from the States, I think he's from Hawaii, and he was a student, he worked at a bank, started his life when he was like 30-year-old or a bit younger. He described my symptoms, and he went to Australia to do a medically supervised water fast where you have a nurse taking your blood and urine samples, your blood pressure. There's a doctor there, there's a psychologist there. And he said he got his life back. So I was very interested in that. And I believe that when we do water fast, when we remove all other food, the toxin in our body will be removed, because I had several operations under general anesthetics, and I believe I never fully detoxified the glue metallic taste that when you wake up, or some people wake up from a general anesthetic that have in the mouth. Later, I did a DNA nutritional analysis, and they told me that I'm not making glutathione, which is a master antioxidant, and both my genes, which are able to produce it, are not existing for some reason. So suddenly that made sense to me. So when I did a water, and I didn't know that at the time of the water fast, but I felt water fasting will cleanse me, will make my body remove any toxin, any virus that may be there, and
So, in other words, a flushing out, a
a flashing up.
flushing out.
And I absolutely, there's about 5 or 6 or 7 pillars, which I would say for my extreme diets, practices, things which I can say they helped me for sure. I will not recommend it to anyone. I'm not qualified to recommend it, just my personal thing, what I felt. Hyperbaric chamber, water fasting, being fruitarian. I just ate watermelon for 2 or 3 weeks. And I did another one when I just had, it's called a fruit island. I just had banana for 3 weeks. And I did another one that I had mango for 2 weeks. Those times, my digestion was perfect. You go to the toilet, you squat, you have oily cigars, you don't use paper, there's no smell to it, there's no smell to your armpit. My mind was a little bit sharper than usual. My joint, usually I cannot open and close my hands like that until a few years ago. The pain to push to do that, you would see tears running off my hands. And I'm a very motivated, strong-minded individual. I ran over 60 kilometers, so more than a marathon when I was 18-year old. I cycled when I was 18, 160 kilometers in one go. I'm dyslexic. I did my A-levels, my psychology degree. I did it orally. I'd never written an essay by hand. I did it all orally. So I'm very motivated to achieve things, and those are the kind of things. And so yeah, it really helped me, but I can't say that I'm cured. I'm also trying at the moment for 2 months LDN, which is low naltrexone dose.
Right.
Naltrexone, I believe, is used for people with addictions of alcohol or opiates.
Opiates and alcohol, yeah.
And you give 50 or 200 milligram or something. But I'm doing the low dose, so I start with
The low
half a
dose, yeah.
milligram, and I'm now after 2 months to 4.5. And they say the sweet point for fibro is between 3 and 4.5. And that has really helped. I think it has something to do with serotonin. It helped my sleep. gives me the craziest, vivid dreams. It's like I'm taking
Yes, that's
magic
one of the,
baths.
they say that's one of the side effects of it. You have incredible, vivid dreams, but it can also lead to headaches. And so it boosts your endogenous opiate production, which has an effect on pain modulation. And it also helps to reduce central sensitization. So again, pain amplifications. I'd say that, we need more large scale, placebo controlled trials. There have been some small trials carried out investigating low dose, but naltrexone. But we need anyway. If somebody finds that it's beneficial, again, I'm all on for that as long as it's done within a safe and controlled situation. Now it's interesting, if you stop and you think about someone like Albert Einstein. I find it interesting that Albert Einstein said that that rational thinking, which if you think about it, rational thinking is the model of thinking of the scientist. And Albert Einstein said that it wasn't sufficient in dealing with the problems of our social life. And in fact, in another related context, he said we need a new way of thinking. Now, and this, as I say, is an interesting remark coming particularly from Einstein, because he wasn't arguing that we don't need to think rationally. He was arguing that rational thinking by itself is not sufficient to deal with, certain types of problems that involve context dependency or complexity, what I call the stochastic nature of cellular activity. Stochastic is non-deterministic, it's non-linear. So these are all issues that are central to the way in which I view the human body and the way in which I teach. So please bear in mind as well, by the way, that when I'm teaching medical undergraduate students, I have to stick to strict definitions and strict standards, because there's legal implications. In my private dissection courses and in my private workshops, I would always let the learner know what the official stance is, and then say, however, here's my hypothesis, or here's my stance in relation to whatever it is that we're talking about. So from my perspective, you were saying, like, what kind of advice can we give, for instance, to people who are listening? Well, there are several therapists who might specialize in this tissue in the human body called fascia. What we're all dealing with one way or the other is energy. Now, nobody really knows how to describe energy, and nobody really truly understands what energy is. From a very simplistic viewpoint, we can say energy allows us to do things. We could say that. So, for instance, you could say that you take some broccoli, or you take some cheese, or you take a little piece of chocolate. We all love a piece of chocolate. You can take it in its solid form and you can look at it, and it's not going to do anything for you. So what do you have to do? You have to break it apart. In other words, energy was holding it together in the first place. And now you have to break those relationships. You have to break apart the relationships of energy that was holding it together. And you now bring that into your body. You can snap it apart. You can chew it. We're using saliva to help start to break it down, and it goes through the digestive system. And as it does so, it changes in its consistency, in its constitution, until it becomes something called adenosine triphosphate. And ATP, adenosine triphosphate, is a chemical that the human body uses in order for us to think, to run and jump and skip, and to digest food. So that's the chemical that we use. We can't use any other chemical, by the way. There's no other chemical that the human body uses. And the lowly worm in the ground uses the same chemical. Horses, cats, all use the same physiology. And we know that this energy, as I say, allows us to do things. But there's negative energy and positive energy. So I'm going to take out one earphone. If I do this, that's negative energy. That wasn't nice. It didn't feel good. Depending on how it was delivered to me, it was application in this case, but it could be somebody else. So that could be seen as violent and vicious and uncaring. Then there's this type of energy. So this type of energy could be nurturing, caring, loving. And so that's one of the things we need to do. We need to, first of all, understand that we're ultimately dealing with an energetic issue here. And energy comes into the body. It could be a surgery. You were talking about having surgeries. And of course, the surgeon wants to make it minimally invasive. There's no such thing. You can't say that Russia minimally invaded and Ukraine. It's just there's no such thing as minimally invasive, but we know what they mean. They want to try to reduce it. So the fact of the matter is that once you've had a surgery, that is a massive insult to the human body. And in fact, if anybody came at you with a knife and you knew they were going to cut you, you'd want to run away. In this particular case, from a psychological viewpoint, you've allowed yourself to be anesthetized. In other words, what have you removed? Consciousness. You've removed consciousness in order to allow this person to actually injure you. But of course, it's for a greater good. It could be that they're removing a tumor, or it could be that they're doing something else that they believe is therapeutically or medically sound. So we're not disagreeing with that side of things. But one way or the other, there's been a disruption to the energy. And so I would say working with individuals who, one, understand fascia, a very more, oh, and by the way, fascia is described as not being, it's described as saying it's non-degenerative, it's not life-threatening, and it's not all in your head. So I think that education, for example, educating an individual on its own can actually reduce fear and improve symptoms. There are other therapies out there. I don't know if you've heard of polyvagal therapy or polyvagal theory, which is Dr. Stephen Porges. I like that. I love polyvagal theory, and I love integrating aspects of polyvagal theory into whatever work you do. So it's a mixture of perhaps somebody who understands fascia. If you are going for treatments in fascia specific to fibromyalgia and chronic fatigue, avoid somebody who's constantly talking. When you're in a therapy session, you really need to have the therapist tune in to the body so that there is an exchange of energy in a way that the fascia, one, that the body can feel safe, and then that there may be an exchange of information from one body to the next. So polyvagal is for people who don't know anything about it, I would suggest you certainly look up polyvagal. Try to, if you can, come to terms with more knowledge relating around fascia, because when the body is insulted, this tissue deep to your skin, deep to the skin here, which is the superficial fascia, and then the deeper fascia that's running everywhere. It's everywhere in the human body. It's ubiquitous tissue. It can lose hydration. So, for instance, just drinking water on its own is not enough. Oh, by the way, I can't drink water. Water makes me sick. If I drink any water, and I try to drink water everywhere I go in the world, and I get violently sick for 3 or 4 days. So I can drink anything but water. People might say, no, drink this with something in it, like a fructose or whatever. If I showed you this and said, would you consider this to be water? There'd be people who'd be disgusted with me for drinking this. They'd say, that's not water, John, that's Coke, you see? So even though what would it be? It'd be 96% water and then 4%, or maybe 94% and 6%, whatever else is in there. So it is predominantly water, but I have to have something in the water. I can drink orange juices, I can drink beer. But if you give me water, it'll actually make me sick. Isn't that a peculiar one? And everybody wants to cure me. Everybody wants to fix me. My mum was the same, but it's not something that I've ever found that works for me, unless I have something in it. If I dissolve something into it, then I'm able to, my stomach seems to be able to deal with it, So I suppose I have an empathy there for people who have chronic fatigue problems, etc. I have no thyroid, by the way. I lost my thyroid many years ago, so that's a big issue. And so I was going through chronic fatigue, trying to figure out what was going on in my body. And I've had to come up with my own strategies. And I live a normal life, but I know the triggers that I have to avoid. I know the type of things that my body doesn't like me doing. So I avoid those things. Some of those, I'll give you an example of one, Eden. So, for example, I can run up the stairs, but I can't walk the stairs slowly. If I walk up the stairs slowly, my muscles will be completely fatigued by the time I get to the top of the stairs. If I run up the stairs, no problem whatsoever. Now, if I had time, I'd go into the physiology of that and explain why that is the case. And therefore, I tend to avoid certain slower movements because they're working off a different system and they have a different impact in terms of the physiology. So in many cases, it's about managing it. Now, I don't have the same symptoms as I would have had 19, 20 years ago when this kind of started. And by the way, my mum had it as well, and my sister had it. And I only just discovered that one day talking to my sister. She said, "Oh yeah, I don't have a thyroid either." And I said, "Why did you never?" Because I was mentioning it to her. And I said, "Why did you never mention it to me over the years?" She said, "Oh, mum hasn't got a thyroid." I said, "What?" I said, "I never even knew that her mum never had a thyroid." So it's funny how even within a family, my sister lives in Spain, so there was that distance thing between us. So then you might ask yourself the question: is it genetic or epigenetic? That's another conversation for the day. Maybe we'll talk again on, because these are big topics and there's a lot to discuss. But fascia, as I say, fascia can become thick and sticky. It can thicken, and this is really putting tensional and compressional forces onto cells and nerves. So really what we need to do is we need to find therapies where you can have a quiescent experience. Quiescence means stillness, quietness, and that's a very important part, by the way. Meditating, being present, being in the moment, but feeling safe. And then a good therapist will understand how to be able to work with the fascial system in order to be able to try to return it to what some people, this is not my favorite word, but to return it to what they would call homeostasis. And there are other words I would prefer to use. But again, as I say, I just don't want to overload people with information just in the short time that we're talking.
So much. That's really interesting, the fascia tissue. I've never considered that. So just to kind of see if I got it between brain fog and trying to work it all out, it's basically the tissue that protects our nervous system and that it glides in.
Yeah, it protects everything. In other words, without fascia, you couldn't have a liver. Without fascia, you couldn't have a nervous system, or you couldn't have, the circulatory system has its blood vessels in the heart, but the blood vessels in the heart need the fascia. They need this connective tissue in order to be able to be. So we are not outside the system. We are the system, and this is what we need to understand. So fascia is ubiquitous. It's everywhere in the human body, but it needs to be fluidic. It needs to be able to glide. Glide is a key word. And what can happen when there is either a threat to the body, a real threat or a perceived threat, then the level of safety lowers and the body goes into fight or flight. And this has an negative effect on connective tissue. It's fine in the short term, but if it stays within the body long term, then it has negative effects. And this can lead then to ramping up pain and ramping up sensations. And oftentimes, as I say, that they become central sensitization. One thing I'll maybe we try to finish on this if we can, because I know people haven't got all day to listen to me talking, but just to understand something about the way in which, so there is hierarchy within the human body, okay? There is hierarchy. In terms of your nervous system, remember I told you the nerves come out on either side? Okay. So if the nerves are coming out either side, you could have a nerve that, for instance, goes all the way down to your fingertips. It has to. You see, we have different nerves. We have several different nerves, medium nerve, and so on. We have various different nerves. If a nerve is insulted, or indeed if it's injured, but I prefer the word insult. So if it's insulted, so a person might, for instance, have pain here in the wrist. Now, within the medical profession, they say, "Oh, you have carpal tunnel syndrome." Now, the reason they say that is because there is a ligament that runs across here, and that ligament can thicken. So the question would be one, well, why is it thickening? Who has informed the ligament to thicken? Okay, so the ligament the tissue is simply responding to the information that's being provided to it. Now, that sometimes could be as a consequence of what we call repetitive strain. So you're doing something like, let's say you're polishing something on a regular basis, and that constant motion is calling for this ligament to thicken, and it puts pressure on a nerve that runs right down through there, called the median nerve. It runs right down through a little group of bones that are shaped, we'll say, like that, and the nerve runs through them. It's called the carpus. So, okay, if that was the true cause of the pain, then you'd have to say, well, let's see if we can reverse the thickening of the ligament. Can we one, get you to stop or reduce doing this? Of course, the medical profession wish to cut it. They'll say, cut it. That takes the tension off the nerve. but then you can't think, well, what's the consequence of cutting the ligament? That's if that is the true source of the pain. Remember, this nerve that we're talking about originated all the way up here. Now, in anatomy, we have something called the 3 Ps, places of perilous passage. So anywhere from the nerve coming out of your spinal cord to its final destination, there are specific areas that are more prone to the nerve becoming tethered and therefore not gliding. So good therapists, particularly those who specialize in fascia, would know these places of perilous passage. And all of those should be considered for treatment. However, this is the main point I want to make to you. If this problem goes unresolved, nervous information that's traveling from your spinal cord to your wrist, spinal cord to wrist, will spill over to the opposite side. Now you'll begin to get symptoms in this wrist. And people will often say, oh, I must be compensating. In other words, because my right wrist is sore, I'm obviously using my left wrist more, and therefore I'm now starting to have the same symptoms. Oftentimes, this has nothing to do with compensation. It has to do with the way the nervous system is hierarchically organized. You're getting a spillover at the same segmental level. This hand is completely innocent. You have done nothing to it, but you're experiencing pain. Now you have pain in both wrists, and the level of neural activity traveling from your spinal cord to your hands and back to your spinal cord. Now, this could be a knee, this could be an ankle, this could be a hip. I just happen to pick the wrists, okay? If that level of neural activity goes unresolved, no therapeutic intervention, the problem now is that the neural information will now travel upwards into your cerebral cortex, into your brain. Once it does that, you're in trouble because it can only do one of two things. It will come out, in other words, it will come down, and it will either go somewhere. So if it's somewhere, it could come out and go to your shoulder. Now you've got pain in your shoulder and you think you've done something, but in fact, it was all due to the fact that you had an original insult that you did not have therapeutically dealt with. The second aspect is it might go somewhere or it goes everywhere, and that is fibromyalgia. So if you can talk to a person, listen to a person's story, and if you can truly find what the original insult to the body was, and it doesn't have to be a physical insult, it could be an emotional insult. And if you can deal with that, and remember, by the way, for me, people talk about spatial medicine. There are no spaces in the human body. For me, it's temporal medicine. It's all about time. And so the longer it's been in the system, then the longer it's going to take to bring you back to, what you might refer to as a homeostasis. It takes time. There are no overnight fixes. Not in my work. I know some people like to go to a chiropractor, an osteopath, and they're fantastic people. But this is why I asked you earlier about why did you drink water? What in your mind, what were you thinking? And in the same way, some people think if they go to a chiropractor and they do this and they go, oh, fantastic, it's a kind of an immediate quick fix. And good luck if that works. But I find that in my 46 years, I find that that's seldom ever resolved. It might give some short-term benefit, but it seldom really resolves the problem. So it takes time. It takes time. And as you said, sometimes you have to investigate, different ideas because, you're in Portugal. Is that correct? You're in Portugal. I'm in Ireland. So, it's kind of hard to be able to point you in the direction of one particular person because I don't quite know who's in your locality or who's in your area. But certainly, if you could, I would encourage people to start looking at fascia as a topic and be thinking about the conscious versus subconscious or preconscious activity. And that's what and it's the belief system. People feel, no, I have to take a drug or no, I have to. And I'm not against drug taking. I think it's fine temporarily. But believe it or not, it's dealing with energy. And if you can find somebody who can do that, you will be amazed at the changes that you will get. But it will take time for your physiology to change, the neurophysiology. That's as good as I could do today, I think, you know.
You done very well. I can already think of one friend I've recently spoke to. He's a very good friend, and he's a little bit going quiet, I've noticed. And he tells me about his pain all over the body, and the guy is a machine. He's in his 50s, he's fit as anyone. He's like a bodybuilder. He worked all his life in the gym from the age of 14, I think, and he's a very, very powerful guy. But and he still worked through the pain. And he told me his mom has the same pain all over the body as he has. So I'm gonna have to refer him to you. And if you will be able to leave some contact for people to have consultation with you, I would appreciate, because I think what you described, it's really what he's going through. I'm pretty sure he has something with his fascia. He hasn't got the brain fog. He hasn't got the energy problem that I do. He hasn't got any other digestive problems, which often fibromyalgia, chronic fatigue syndrome, we come up with. He specifically has just the pain, and he doesn't have the nodules, inflammation. He doesn't do flu and cold. He's super fit. Um, so that's really, really good stuff. I am.
People often contact me and say, can they come for treatment? Unfortunately, the problem with coming to someone like me for a treatment is that, first of all, when I meet people, it would be, I don't quite know what to say to you in this regard, but it would be several sessions before I might even begin to treat. Although you could say I'm treating from the word go, because, as I said, it's individualistic. I'm not in a position to take on new patients or new clients because I just happen to be, capacity. But even if I do have, and I do have, because I have colleagues who will bring their patients to me, but they're their patient, and they're really looking for another opinion, and for me to kind of put my eye to it. But you have to have continuity. You can't just come to a person and expect to have all your answers in one session. That's just if I don't work that way. My brain doesn't work that way. And when I'm sleeping, I often will wake up saying, I never, I wake up. So I've obviously been mulling it over, as I say, in my head without being consciously aware. And I've had a good night's sleep, but yet I've been giving thought to the problem. Now, I often find that happens to me all the time. And so I'm not a quick fix. I don't fix anything, but I'm not a quick fix merchant, as they say. I'm somebody who likes to take my time, get to know the individual, really get to listen to their individual story, and then work with them on that basis. But certainly in trying to understand the vagus apparatus, the vagal tone, and how, insult to the body or the feeling of threat, whether you are consciously aware of the feeling of threat, because it could be internal. This can lead to what we call dorsal vagal collapse, which leads to a disconnection with the world, and can have serious implications. In other words, look after your friends, because although they say things like fibromyalgia is not life threatening, and being in pain or having these changes in sensations every day and not being able to find somebody who can offer you some type of intervention, that leads to serious depression. So and then maybe some bad thoughts, etc. So look after your friends. It's great to hear you, even the fact that you're thinking about your friend. That's a wonderful reflection of your personality.
Of course. Thank you. Thank you for noticing it. And acupuncture, is that to do with fascia or energy movement? This Chinese medicine person, acupuncturist, he explained to me that how it works. Because I'm not very spiritual, it's difficult for me to understand certain things and just to believe that something. Well, he told me you have a nervous system, and by putting needles in certain point, I can stimulate those nerves to start repairing or releasing the flow of something. So that kind of made sense. I did quite a few sessions. I can't say it helped me. I like the therapeutic effect. He was a very, very nice person. He was listening, same approach to you. He wanted to get to know me. He was supportive. And that in itself, I always find helpful. Um, but any thoughts on acupuncture or Chinese medicine, something that maybe you may not?
Yeah, people ask me these questions about yoga, acupuncture, etc. So I'm 46 years on this journey. I've got many friends who are acupuncturists, many friends who are chiropractors, who are osteopaths. I'm not. Why am I not? I've got 6 degrees. I could have chosen to do a degree in chiropractic, or I could have chosen to study. I might not have studied acupuncture to a point. I'm not an acupuncturist, nor have I taken any formal studies in it. I understand what they do to a large extent. I would say, okay, so first of all, if somebody said to me, I place a needle in a nerve, you would never place a needle in a nerve. I'm coming at this from the viewpoint of a clinical anatomist. If you tap a needle into the body, now, of course, by the way, remember that nerves start out being quite large. So, for instance, if you wish to, you can go between, let's call this your flexor, your flexor tissues, and we call these your extensor tissues. And you might see just here, there's a little line. So I can take my fingers in there. So that's what we call a septum, and I can feel it. And as you go in there and go back to the bone and now bring your fingers up and down, oh, that's horrible. That's my nerves. So that's your neurovascular structures. These are nerves and blood vessels. So as a needle is approaching, and I remember nerves need to get smaller and smaller and smaller and smaller, so they become microscopic. But when you tap a needle into tissues, that if you were purposely to go after a nerve, if you went slow, you'd feel the needle approaching the nerve. You go, oh, stop, stop, stop. Now, if somebody was to go in really fast, which happens sometimes, some people use needles very, very fast. In my estimation, I would say that's not a good thing. So, in fact, what's actually happening in my estimation, is that when the needle is tapped in, so for instance, sometimes people say to me, "Oh, John, if there's a little area here," and they'll call it whatever they want to call it, heater 54, or lung 32, or whatever term and they say, and this is where you place the needle. What I see happening, in fact, is what I would call a needle effect. So in other words, I can't talk about the philosophy of traditional Chinese medicine, but I can't talk about the philosophy of acupuncture, because it's not something that, they're talking about it in terms of energy, which I mentioned to you. We're all dealing with energy. So that's their way of describing energy fields. For me, what's happening, in fact, is a needle effect. When the needle is inserted through the skin and into the fascia reacts. The fascia reacts by grabbing the needle and twisting it. And it always twists the needle in a clockwise direction. Now, that twisting of the needle, if you can imagine where a nerve and blood vessel, so I call it these neurovascular structures, as they're coming from they have to come from your spinal cord, and they have to make their way out, but they're coming from the depths, and they're coming from the depths up to the skin. So as they come up from the depths, they're coming through the fascia, like my finger coming through these two fingers. And so you'll see these little eccentric rings of collagen around where the nerves are coming through the fascia. You don't see them anywhere else, but where the nerves coming through the fascia, you'll see the arrangement of the fascia changing in these little eccentric fibrous collagen. And so what happens is, as I say, it rotates in a clockwise direction. And so what that does is it spirals and expands and takes pressure off both the nerve and the blood vessels. And so a person might then say, "Oh, I feel warmth into my hands." In other words, they're now feeling a return to normal vasculature, where there may have been some kind of deficiency in terms of either supply of blood or removal of blood to the venous system. And that's what I think it is. I think it's a needle effect. And I think what it's doing is it's taking tension off of the fascia. And so it's up to acupuncturists to describe and defend what they do. But that's what I see is happening, in terms of using the needle. So if somebody goes to an acupuncturist, and there's different types of acupuncturists now, some who do deep needle insertions, some only do subcutaneous needle insertion, some place the needle anywhere in the body. If it gives you a therapeutic response and makes you feel better, well then, if you can justify it, I just be careful about the idea of something making you feel better. Remember, taking cocaine can make you feel better, but it's not necessarily something you'd recommend that you do on a regular basis. In other words, you have to have a rationale. You have to be able to explain, which is why I asked Eden earlier, why Did you want to go on a water-only diet? It's not about going on something just because. Maybe it could be. Maybe you might say to me, do you know what, Sean, I don't really know why, but I'm just going to experiment because I need to try something. And I'll say, okay, well, that's fine. But have you, are there risks involved? Do you understand what the pros and cons are? Are you willing to take the risks? Yes, I am, because I'm in a bad place. Absolutely fine. Okay. We live in democracies and we're fighting for democracy at the moment all over the world. So freedom of choice, absolutely. But I would like you to be informed. I'd like you to at least have some idea in your mind as to what the risk versus benefit would be. That's the preferred stance I'd like. It's hard to say anything other than that. But fascia is, to me, fascia is the stage of anatomy, but it's more than the stage. It is the actors on the stage. It is the script. It's the words on the page, and it's the space between the words. Fascia is the most important tissue in the human body, and if you haven't considered it, you really do need to start looking into fascia and becoming more knowledgeable in relation to fascia's role in terms of modulating pain or controlling pain, movement, everything, life.
On Sharkey, it's been really informative and very interesting,
Yes.
and something that I don't hear, and I might have came across it, but never paid attention to it. So thank you so much for really going in depth here. I feel you're one of these people I can have many time on the show, and each time I will learn more and more. I'm very interested in the human anatomy, and I'm sure you dissected hundreds, if not thousands, of bodies. So you've seen things, and so it's very interesting for me how the human works and how it's formed. So thank you so much. I'm gonna leave your details in the description below if people want to attend
Excellent.
your classes, your conferences, your events. I know you're very active. So thank you once again, and I have a feeling we're gonna meet again soon.
No problem. I'm delighted to have spent a little bit of time with you, Eden. I didn't know you before this. I wanted to take a quick little look at what it is that you're doing. And you want to obviously help yourself, but you want to help other people. And that is a wonderful trait in your personality. We need more people in the world to have empathy and to share love. We're not in a good place in the world at the moment. So that's why I came on. That's why I was quick to respond to you.
You too.
And if we can just have a positive impact on a small number of people within our communities, well, then I think, that's a good legacy. So delighted to talk to you. And hopefully our paths will cross at some stage in 26 or 27, including your community who are listening. And I wish them all very well. And thanks for talking.
Thank you. Thank you again, John.
Not a problem.